In the 1970s, there was growing interest and research demonstrating the benefits of exercise in cardiac patients. But there were concerns about safety and whether it could be widely adapted in clinical care. In this pre-internet era, it became clear that there was value in concentrating cardiac rehabilitation literature into a single journal. That's exactly what Dr. Michael Pollack sensed at a conference he organized in 1978. He called on Dr. Victor Freulicher, physician and principal investigator of a trial on the effect of exercise training for patients with heart disease, to be the co-editor for this new journal. The first issue of the Journal of Cardiac Rehabilitation was published in January of 1981. In 1985, AACVPR was founded and adopted JCR, renaming the journal to the Journal of Cardiopulmonary Rehabilitation, or JCRP. This change highlighted the importance of pulmonary rehabilitation. The JCRP became AACVPR's official journal. In 1988, Lippincott, William, and Wilkins became the journal's publisher, a more than 30-year relationship we still have today.
When I was nominated by the AACVPR board to serve as the next editor-in-chief, I presented a 5-year strategic plan with the primary goal of getting JCR included in Index Medicus. From 1990 to 1995, nearly 400 submitted manuscripts were peer-reviewed, and in 1994, JCR was designated as the official journal of the Canadian Association of Cardiac Rehabilitation, widening our sphere of influence. But after a second rejection from Index Medicus, I knew what we had to do. Following an unconventional face-to-face meeting I had with the executive editor of the National Library of Medicine, JCR was ultimately awarded inclusion in Index Medicus in November 1995. Clearly, this catapulted our mission and outreach.
In January 2007, we changed our name to that which you already know, the Journal of Cardiopulmonary Rehabilitation and Prevention, which reinforced our emphasis on preventive care as well as exercise-based interventions. This was the change that influenced our inclusion into the International Scientific Indexing. The combination of scientific reviews and evidence-based guidelines for both cardiac and pulmonary rehabilitation helped establish JCRP as a core component in the management of cardiovascular and chronic obstructive pulmonary diseases. Recognizing the value and benefits of rehabilitation in these patients led to an increase in clinician referrals and patient participation. The interest and evolution of JCRP has been AACVPR's guiding light to develop and expand translational and program guidelines, providing regular updates to recommendations and strategies for treatments and the care of our patients.
As the fields of cardiac and pulmonary rehabilitation, as well as prevention, evolve into the future, JCRP is publishing articles that highlight trends that will help improve upon existing programs. With the foresight and pioneering vision of Drs. Pollack and Frolicher in 1981, JCRP is now well established and widely recognized as the primary resource for the publication of current clinically relevant research, state-of-the-art reviews, and scientific statements in both North America and around the world. I'd like to recognize the exemplary efforts of the many researchers and clinicians who contributed to JCRP, the former and current editors and editorial board members that guided JCRP, and our publisher, Walters Clore Health, for all their work over the past 40 years. I'm thrilled to be celebrating our 40th anniversary and the role JCRP plays in our rewarding fields with our formidable missions. I'm excited about the present, and I look forward to the next 40 years of JCRP. Advances in our field will likely be significantly impacted by the future publications contained in JCRP.